Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are honored to welcome a remarkable person, Consuela Marshall. Consuela is an author, occupational therapist, founder of Finding a Foothold and the Finding a Foothold Foundation. Welcome, Consuela. How are you?
Thank you. I'm fine. I'm so happy to be here.
Oh, it's our pleasure. It's our pleasure. We've been looking forward to this. I want to just kind of start off here. I introduced you as an occupational therapist, and you've been an occupational therapist for more than 30 years. What inspired you to enter that profession?
I didn't purposely, I'll start by saying I didn't know that there was a such thing as an occupational therapist until I came face to face with the need for those services when I had a daughter who was born with some physical disabilities. And with that was her need for occupational and physical therapy services. So that was my introduction to OT. And I was blown away by what occupational therapists did. And being a mom who wanted to know how to best support my daughter with all the uncertainties that were racing through my head and through my husband's head about what do we do? It eventually just became it just felt like it was the thing to do, to support her needs. And looking at face to face with something that fulfills something that I've always wanted to have a place to fit. Like even at that time I was in college.
Yeah.
But just going through the motions because college is what you do. But this gave me direction, and it was my launch into a field that I've grown to just love. And the blessing of the whole thing was it has just really changed my life.
That's incredible. I did not know that. Thank you for sharing that. Oftentimes people, when they're faced with adversity or uncertainty, they kind of look for others to correct it and to fix it, but you kind of took it upon yourself to fix it yourself. I think that's just incredible.
You're making it sound easy, but it was a
I'm not making it sound easy. I know it wasn't easy, but it gave you purpose, right? I mean, and I think, as a result of that, you're now here, all these years later, 30 plus years as an occupational therapist, continuing to help support others. So I think that's incredible, And, kind of piggybacking off of that, Consuela, you have walked that caregiving journey personally, like you shared, caring for loved ones also with Alzheimer's and even after suffering strokes. What were some of those biggest lessons that you learned during that season of your life?
At the point where a loved one had a diagnosis of dementia and my mom had first of many strokes, I was well into being it's probably 15 years. And with that knowledge base, I thought I was more than prepared to handle whatever, being able to already going into that situation, knowing how to do transfers, how to mobilize people, how to educate them on how to look at what is remaining in their abilities and teaching them how to maximize their independence. That's what OTs do. And going into the situation of being a caregiver, I thought, well, look, I'm equipped for this. I've got all of these tools in my tool bag. Little did I know that, yes, those were great things to bring into a caregiving role. But early on, I learned that was only part of the equation. that there's a whole side to caring for someone with a disability, with a limitation that goes beyond academia, that goes beyond what we were taught to do. It brought it from a different angle, and I'm facing things and struggling with caregiving in ways that I never imagined. And the things that began to surface for me is, yes, I know different things. I know how to do things to assist them, but I didn't know how to put that in the context of setting boundaries in how much
Mm.
I'm doing. That when they saw a need or they had a request of, for example, like wanting to get in and out of bed every hour, like getting, like, for example, transferring them out of bed, and then 30 minutes later they want to get back in bed, and I'm like, oh, I can do that. And not knowing the wear and tear that I was doing on my body by trying to be that good daughter or good niece who knows all of these skills, and you got to put them into play. They need me, so I better go do that. I better go do that. Go get this piece of equipment. And I was doing so much and trying to prove that my skills are being used to help my loved ones to have the best life, that I lost sight of setting those limiting boundaries and really holding on to my life. This became the daughter who was trying to prove to my mom that I would do whatever it takes to keep her happy, to keep things grounded, and not even, and even in the instance with helping a loved one who had dementia, uh, helping a loved one living with the dementia who lived in my home with me for a period of time, in even accepting help,
Mm.
because I felt that I know this, so I should be doing this. So those are the things that I learned
Yeah.
in my caregiving role later than sooner than I needed to learn them. And it had such um, negative consequences in my health and in other relationships that were dear to me outside of my caregiving role.
Yeah. Yeah. No, that's the truth too. I know, kind of sticking with that, you eventually turn those experiences though into something that could help others by, as I mentioned, finding a foothold caregiver consulting. What made you decide to then take that step, and what gap were you hoping to help fill for caregivers?
What I was experiencing, I didn't know, I unknowingly, let me see how to rephrase this.
Yeah.
What I was experiencing in my own life in real time, I did not realize I saw it in operation in my patient's life for years.
Yeah.
As I would enter a home and I'm working with a patient that had a stroke, and I'm teaching that patient how to utilize their skills and teaching her caregiver how to come alongside that and allow them to do what they can and how to assist them. I often wondered why they don't get it. They're still doing too much. They're still hurting themselves. They're still just doing things and not really seeing the impact it's having on their life, and that they're not able to step back and just allow that person to function within the limitations that they have, and not trying to keep things normal in the way that they want to. Let me see if I can explain that. Sometimes caregivers want things back the way they used to be before
Right.
it happened, and they do all of this work to try to make the picture of life like it used to be, and oftentimes it's not going to be that way.
Right.
I didn't realize I was thinking that. And now that it happened in my life, I'm like, I understand why they're doing what they're doing, because of that emotional component that goes with it. That you just have this desire to want that person to get better and be their best. So you're doing and overworking and doing things the wrong way, partly because you haven't been taught. You've been
Right.
thrown in, and you're just like, this needs to be done. You're feeling the strain of the task, but you're doing it anyway because it has to be done.
Right.
I thought, as I'm processing all of this, I see what's happening, and if there's any, and it just began to just be. It came at a point in my time where I was looking in my career of there's more than this, and the pieces started coming together for me and me thinking, you know what, I need to share this with others. I need to share with caregivers, because now I know the emotional part that I couldn't articulate, and and I'm gonna stop right there. Slow down. I didn't know the emotional impact. I didn't know how that emotional piece impacted your daily life as a caregiver. And I think that was missing in all of my education and training with caregivers over the years. I'm just thinking, they just need to stop doing so much and setting, I wasn't calling it setting limits. They need just to take better care of themselves. I was missing something. And when I saw the whole picture of it takes knowing what to do, a therapist, getting it doesn't take a therapist. A lot of things you can figure out yourself, but there's a lot of technical things specific to different diagnoses that having a therapist input does make life easier for the patient and for the caregiver. So just imagine they having the whole picture. They're getting therapy from whatever means, not just me, but then also coupling that with insight about the boundaries, taking care of themselves, setting limits in their life on what they can and cannot do, and building that team, and being able to put both of those things together. Even as I continued to do therapy, and even as I continued in home health, I saw tremendous change in just my patients, because now I'm adding both components. I'm teaching them from an OT standpoint, and now I'm giving them information from a lived experience about how you have to also weave in how you're going to manage your emotions, and that awareness that you have to have in order to protect yourself, in order to continue to be here for your loved one and for other people and other relationships that you have in your life.
Yeah, and you're preaching to the choir there, Consuela. I tell people all the time, the clinical side is as important as the personal side, because, you wouldn't have been as effective had you not gone through it yourself. But having been, lived it yourself, and then had the professional education and training, when you marry the two of those together, it's such a force for good that is supporting caregivers everywhere and their loved ones. So it's a wonderful thing that, you decided to take up that mantle and, do the work that you're doing, and, you're doing such tremendous work, and there are many great caregiver coaches and programs out there. How would you describe your approach, and how does your background as an occupational therapist make that different?
You're right. There are some incredible coaches out there. I follow many on Facebook, Instagram, all the platforms. They're giving some great information out there. What I add and what I feel makes me different is that uniqueness of being an occupational therapist. Immediately, well, stop and say this. But this is one thing that I saw was missing. I hear it over and over and over again by many of the ones that I admire saying, take care of yourself.
Mm.
Make time for yourself. You have to take care of yourself. Can't give from an empty cup. Put your face mask on first. All of those things, and it would make it look. And the word self-care, I try not to use it myself because I treat that word or words as if now you're telling the caregiver to do something else on top of everything that they are already doing. And it can be offensive because now I got to take care of myself. And like,
Yeah.
how?
Yeah.
When am I going to take care of myself?
Don't you think I would if I could? That kind of thing. Yeah.
Yes. The uniqueness of the approach that I bring. I'm going to show you by assessing and analyzing what you're doing in the way of that physical part of caregiving, where you are wasting time in the how you're doing it, where you are utilizing 30 minutes to do a task that should take 10 minutes because your environment is not set up properly. You don't have the equipment. You're doing things that you shouldn't be doing, and you are tired, and you can't take care of yourself because you're so drained because you're working too hard.
Right.
So my goal in my coaching sessions is helping you to identify where you are losing time throughout the day, by the way of getting you to really analyze and look at how you are helping with ADLs, the dressing, the bathing, the toileting. Why is it taking you 25 minutes to get through just one activity? Let's break that activity down and see why that's no longer reasonable, how you're doing that task. That person is beyond that stage of you continuing to do dressing or grooming or bathing in that manner. Let's consider another approach. Let's consider and laying out a plan and see them take one task from this much time to this time. And guess what? You've just freed up a bank of time that you can put over to the side that you're going to learn to use for yourself. So let's break down every activity during the course of your caregiving. And what are some things you can do better at delegating out? And what are some things that you can do better at setting up your environment? What are some things that your loved one can do for themselves if the environment is set up correctly? And what are some things that need to come off the plate because they're no longer relevant at this stage of your loved one's disease process?
Mm.
Or because things in your life have now changed that you no longer have the bandwidth to continue to do this part or these activities for your patient. For your loved one. And that's the approach I like to use. Not telling them do self-care. I'm like, look, let's make your day easier. Let's talk about. Let's look at. Now, let's look at some options and see which one of these fit for what you need, not what your loved one needs. Sometimes they're not going to be happy when you start to make these shifts, but these are things you have to do to protect your ability to remain present for the other people in your life, because your husband is too far in the background. Your children are growing and you are missing vital stages of your children's lives. They don't get T-ball back. They don't get to be the quarterback again. They don't get to do these things. Your daughter, who really needs your attention, right now at these crucial ages in her development, you're not there because mama wants you to come over to her house and help her with something that is not even relevant anymore, or something that she's causing the breakdown on, and now you've got to go fix.
Yeah.
When my approach is, let's make life easier. I won't have to tell you to do self-care, because guess what? You're going to sit down and like, oh, that didn't take that long. I think I'm going to go outside and drink a cup of coffee.
Mm.
And that's the beauty about being an OT. I want to show you where you're leaking time in your day. And you make the decision what you're going to do with the time that you're going to recapture after you rethink how you're doing caregiving.
Yeah.
And that's the approach I think I can add that is the missing piece in some other approaches, which are good approaches and they are working, but this is what makes me unique in finding a foothold.
Yeah. No, that's wonderful, Consuela. And, I know you said earlier, I'll just share this, hopefully you don't mind. You said you were really nervous. I don't see any nerves right now. I see we're going to church. So, I do want to talk about something that I am so just in awe of, and I think it's something that is desperately needed. I'm going to have you explain it though, but this year in 2025, you launched the Finding a Foothold Foundation. What led you to start that foundation, and how is its mission different from or connected to your current work?
Yes. When I founded Finding a Foothold, it came out of just that purpose that was just dropped inside of me while I was working with the same home health company, and I still love them to death, for 25 years. So really seeing the same people, the same families, and really going from one generation to the other. Like early in my career, I may have been treating the grandmother. Grandmother's gone, but the caregiver at that time has now aged, and now I became her occupational therapist, and really seeing those scenarios just playing out in my head over the years, and seeing that things are not really just getting better. And I thought just having the LLC, and I thought just Finding a Foothold and getting a message out that they would say yes. And people are saying yes, and people are utilizing my services. But it didn't take long for me to realize the people that I had in my heart when I started Finding a Foothold were just not able to access the services.
Mm.
And I found myself getting phone call. Is this covered by Medicare? Is this covered by Medicaid? Or do you take insurance? And the answer is often no, just for the general context of what I do. But there are times when I listen to a story from someone, I would say, you all really need OT and PT, and I will channel them toward the medical model because it's definitely more appropriate for them. But the people that I wanted to reach I was unreachable to them. And it hurt me, that I'm like, I started this for them. The people that I saw and the generational cycle that I was witnessing were not utilizing my services.
Hmm.
So that just bothered me. And this year, the light bulb came on. You're already giving away so much, because when they call, I just go in and just like, look, it doesn't cover, but what's going on? So I'm end up like just telling them things and, just giving them suggestions that they could utilize. I'm like, why not? I said, this isn't sustainable. It's doing my heart good, but it's not sustainable for me to pour repeatedly, because it's not the fix.
Yeah.
So the foundation dropped into my heart. So I started that process of like looking at what is a foundation or what is a nonprofit, and realizing that is the route to go. That's the missing piece, that when someone calls and they have those questions, is this covered? Is this like, no, but we have a foundation. Now, look, the foundation isn't fully funded. Look, Lance, we're just getting this started, but I am just blown away by the community partners and me just showing up and telling them about what I'm trying to do. And everyone has a fall story. Everyone has a caregiving story. And my whole desire is to bring support to everyone.
Hmm.
For those who have the funding and can pay for the services, there is a route for you. And those who just, our healthcare system doesn't pay for a lot of things that we need.
Right.
And that's the reality of it.
Yep.
And there's just so many gaps in our healthcare system. So being able to add an arm to finding the foothold that brings these services to individuals who otherwise wouldn't have them, that's my desire. Because across the board, our healthcare system does not fund caregiver support.
Right.
They've added a couple new diagnostic codes under the OT model. Yes, and they're useful, but it doesn't nearly touch the surface of what people need.
Right.
And in the area of fall prevention is available through our medical model after you've had a fall.
Yeah, exactly. Not preventative.
But not preventative.
Yeah.
And those two pillars of Finding a Foothold and the Finding a Foothold Foundation is to support family caregivers and to support aging older adults in providing education on fall prevention. Because another thing I've learned in my years of being an OT, a great deal of those who are in a caregiving role are in that role because their loved one had a fall. A great percentage of them. I mean, you enter that role for a whole lot of reasons, right, in being a caregiver. But one that can be prevented, one of the reasons is the falls. And we can prevent falls. We can prevent so many families from prematurely entering into a caregiving role.
Absolutely. Absolutely. We, just real quickly, we had met with a family 3-4 weeks ago now, and the brother came in from Arizona and the sister lived locally, mom lived locally on her own, and they were looking to get mom support because, here in Michigan, winter is upon us, and they didn't want mom to have to go to the mailbox, and she's already done driving, but just having that extra support there. And mom, 94-year-old, very spry, very independent woman, lovely lady, but she just needed to think about this. She wasn't sure if she's quite ready yet to have some help. And we respect that. We're not here, just like you, to take away anybody's integrity, their independence or individuality or anything like that. And we always tell families, when we come in the home, you're still the boss. We're just there to do what you need us to do. Very simple. But our main priority is to keep you safe. And so mom said, brother came in again from Arizona because they were ready to do this finally. They'd been talking about it for months. Mom still kind of had that cold feet, and I understand that too. Well, 3 days after the meeting, while mom's still thinking about it, she took a very severe fall and ended up having to go into the hospital, ended up going in the ICU, and she ended up passing away because, and this is over like a 2-week period,
Yes.
She ended up developing pneumonia because, pneumonia, you got to move that air in and out of your lungs, and, she wasn't. And I mean, that's the whole point though, right? We could have hopefully prevented that fall from happening. And it's just, it's a horrible thing. It's kind of, half and half. It's apples and oranges sometimes, and sometimes it's apples and apples. That person has to also be willing to accept that help that you're trying to give them too. The family can be on board all day long, but if you don't get buy-in, it doesn't really matter.
Yes. Oh, it's one of my focuses in my fall prevention program. Exactly what you mentioned, because there is a lot of resistance
Yeah.
at times as they are holding on to independence. They want to just remain in charge,
Yeah.
and rightfully so. You don't get to be 92, 94 and not know what you're doing.
Right.
And now all of a sudden having to let some of that guard down and accept change is hard. Mm-hmm.
Yeah, no, absolutely. And, kind of tying it into, your incredible work, Consuelo, I know you've said that many evidence-based fall prevention programs don't always reach or resonate with underserved communities. How do you approach fall prevention in a way that's culturally relevant and accessible? Because that's a key. We get a lot of families, regardless of where they're at, white, black, brown, yellow, green. If they're low income, and they can't access our services, not by our choice, but the way our healthcare model is designed. So how do you help it to become culturally relevant, but also accessible for people?
Change is difficult, regardless of the age. And then when you factor that into what makes a person who they are and what they value and who they have grown to be, that's an added element that must be taken into play. So when we're talking about aging in general, and the example of the family that you just mentioned, is always about choice.
Yeah.
It's always about autonomy. It's always about, unfortunately, having your hands tied when that individual doesn't want to change and don't see a need to change. Then you add on cultural relevance. For example, it's already difficult within the context of a family who are alike in trying to get change to occur with someone who's older and living alone. So I talk about that it has to be their choice, but we can talk about things that make it their choice, that make them want to make the choice. And it's not going to be you telling them that, Mom, you're going to go into the nursing home, or Mom, that doesn't get it.
Right.
Getting them to see that this is important and irrelevant for me as an individual is the plan that needs to be taken. And that often requires you all getting on the same page. You helping them to see that you want the same thing they want.
Yes.
You want them to be there, but you have identified some things that make it risky for them to be there. Now, take it over into a cultural lens. There are evidence-based fall prevention measures out there. So what I'm saying is not new, and that the world doesn't know that there are falls that are happening. The world knows, and there are some top-notch organizations that for years have been doing the work to lower the falls. And they've had some success in certain markets, in certain areas, in certain areas, but not in all. And I don't have exact figures and facts, but I can tell you what I see, and what I see in the streets is a way of saying it. What I see in real time,
Right.
in my observation as an OT. It is, and it's evidence-based, and it is factual.
Right.
Because they know, meaning let me stop. Organizations are starting to realize that the falls are not going down. In fact, they may be going up in some instances,
Mm.
despite all the research and the evidence-based programs that are out there. Why is it not affecting across the board, regardless of culture? Just regardless of the culture of that person. And then in the context of culture, it's not deemed as being relevant. When fall prevention pictures don't look like your house, they don't, and this is going to be the choppy part, Lance.
You're good. You're good. No, it's real.
When pictures in evidence-based practices show the part of home modifications, which is an important part of fall prevention, and the pictures don't look like your house, they look sterile, they are almost manicured, you think, oh, that's not talking to me. That's for them folks with all the money whose house looks like that or close to that, and they just need to do a little bit tweaky, and then it's going to look like that picture.
Mm.
So, number one, the blinders. Number one, the blinders have gone up. Like I can't. That's not for me. That's not relevant for me.
Mm.
The other side is then still in the context of the home environment. If there's so much removal, you got to get rid of this. Get rid of your rugs. Get rid of this. Do this. Do this. Do this. Culturally, it can be perceived as, I've worked hard for all of this. I value this.
That's mine.
That's mine. And now you're telling me I got to get rid of it, and I've had it all my life, and it hasn't caused me a problem before. I ain't getting rid of my stuff.
Mm-hmm. Yeah.
So we're looking at just so many things. And then you add to the layer of that, the home improvement shows that always show that a home improvement by a couple in their early 20s is going to be $200,000, and they easily afford that. And that's just the cost of home modifications. Then you're already in your mind just have checked out of anything that has to do with fall prevention, because ain't nothing you can do because your house don't look like that, and you can't do all of that. And all of these things that can make anybody say, this is not a message that's talking to me.
Right.
And I see that.
I believe it.
And it's sort of a subconscious thing that's happening that really puts a stain on something that is meant to help. It's really pushing people away from doing things that could make fall prevention something that they began to see that this can help me.
Yeah.
I can go on and on, because then when you're talking about going to Tashi, or however you pronounce that, Lance, I probably butchered that name, and being able to get to these evidence-based programs and the things that just seem so out of reach for not saying it's not a good thing. Look, exercise and your physical health is a very big component of fall prevention. So I mentioned the home environment, but also you can't overlook the physical part that goes with fall prevention, and strengthening and balance and endurance does play a part. But if you're not getting to it, or it's not coming to you, and although you've signed up for a health plan that gives it to you free, it's not going to help you.
Right.
And it's also another reason why people do not think fall prevention is pertinent to, and that's another barrier
Yeah.
that's often present in underserved communities.
Yeah, no, absolutely. Consuelo, I don't want to go down this rabbit hole because I know we're limited on time. But I had a professor in college, wonderful woman. She was half Jamaican, half something else, and and like it's stuff but you don't really think or ponder on, right? And so she's really good at pointing out like a lot of disparities and differences, and and this kind of ties into fall prevention. You said, eating healthy, exercise, having access. But, in lower income communities, which is, dramatically affecting African Americans by far, you always see a McDonald's, Burger King, and Wendy's, right? But if you go in the more affluent neighborhoods, you don't see any of those restaurants. So, they're having access to low income food, but it's low cost, low nutritional value. So they eat that, eat that, eat that. What does that do? They gain weight. They become sedentary. What does that do? You develop, type 2 diabetes. What does that do? You start getting atrophy in your feet or neuropathy in your feet. What happens then? Then you have a fall. So, I mean, it is a chain reaction to all of these things. So, I absolutely understand and hear everything you're saying because it's very true, and then you're in housing, tenant like housing, and maybe the rails broke, and yeah, I mean there's all these things that need to be fixed and need to be addressed, and we just want to help bring it to the forefront so that people become aware of these things.
And I don't want to paint the picture that everyone that's black and brown is destitute
No.
in that area. And I know that's not what you're meaning.
Okay, yeah.
But the message of fall prevention in general
Yes.
to whole classes of people is just not made relevant.
Correct.
Even for the affluent, even for the healthy, even for the corporate black and browns who have parents don't know what to do because much of the information is not made accessible to them.
Yeah, no, 100%. I mean, I was not affluent by any means when I was in college, and that's how I got into what I do now. I was pursuing medical school, and I don't know if I shared this with you before. My wife and I, we were newlyweds. We get a call at like 10 o'clock one night. My dad needed to either come live with us for a couple of weeks or go into rehab. Well, we said, let him come stay with us. That couple of weeks ended up being 2.5 years. I was never given access, provided, or made aware of any sort of community resources. My father was a veteran, had, the Cadillac of Cadillac insurances. I did it all on my own for 2.5 years. And I finally had the thought, if you will, that we should start a company that helps people like my wife and I, not knowing there's an entire billion-dollar industry out there doing that exact thing because no one ever made me aware of it. Yes. And it's kind of the same thing you're saying right now about fall prevention. People aren't made aware of these things, so they don't know. And that's why you do what you do and we do what we do, because we're trying to make people aware of it. I want to also mention, I didn't say this in the address here, but you're also the author of Fall Prevention, Planning Not to Fall. What inspired you to write that, and what key message do you hope that readers and listeners will take away from the book?
That fall prevention and fall prevention measures are not always expensive, that there are low costs. Let me start this one over. In writing the book, one of the key points I want to emphasize is that falls happen just in the course of life. And they're not planned. You get up with a list. You're going to go by the store and you're going to stop by and pick up this, and you're doing this and this and this, and you're living your life. You're just doing life. And then the fall interrupts that. The misconception is that fall has happened to Miss Jones or Miss Smith or Mr. Bob because they are just not careful. They should have known better. But no, they were just doing life.
Yeah.
Not realizing that things were changing inside of them. And those things that just come with aging that need to be compensated for, and they don't know. So in this book, and what really prompted me to do the book, what prompted me to write the book was many people did not realize that they are at risk because they really haven't identified with it. So if I can write stories that are similar to like a chicken noodle for the soul book, that you can just peep into the life of someone who was just living their life until it was interrupted by a fall.
Yeah.
And the book is called Fall Prevention, Planning Not to Fall. Because no one wakes up and says, when I leave the library and I'm rushing back in the house because I want to go, I hear the phone ringing, or you're trying to get somewhere in a hurry and you're not paying attention to something that you're doing and you trip,
Just that simple.
you have a fall.
Yeah.
So that book is written to just increase the awareness that a fall is not something in isolation of life. It is right in the middle of life, and it is interrupting lives, and it is interrupting the whole family involved around the person who has had the fall. So in that book, I want to make it real, allowing people to see themselves and identify themselves in stories, and to and really shed the light on the fact that not all fall prevention measures are expensive.
Right.
And going back to what I said about the HGTV, excuse me, going back to what I said about the pictures on TV about home modifications and how it can make you believe that they're all extravagant.
Right.
This book is going to really debunk that myth.
It's real.
There are so many low-cost things that you can do in your home, not only in your home, because home modifications in themselves do not decrease falls drastically. It's also behaviors.
Absolutely.
And getting people to change behaviors is free. It's a hard thing to do, but it's a free thing to do. And just getting people through the book, really see how little modifications and how they're living life can reduce falls. So,
no, absolutely.
That's the reason for the book.
Yes. Well, I just want to say, Consuela, we are such big fans of yours. I just think, you have such a great, approach and wisdom, and just, you keep it real. You're not sugarcoating it. And my mother was a nurse for many years, and she works for us now at our company. But she always says, I used to work for a doctor. He says, if I don't know the answer, I'll find it out for you, but I'm never going to hurt you if I can't help you. And that's kind of how I look at you. You're not going to hurt anybody. You're here to only help them, and I think people will just be benefited for years to come from the work you're doing. But I want to ask you, though, for listeners who want to support your mission, how can they get involved? Whether, by making a donation, sponsoring a workshop, or scheduling online workshops and services that help to, fund your efforts. How can they get active?
Yes. All of the above.
All of the above.
Yes. Like I mentioned earlier, the foundation, we just launched in May of this, we launched in March of 2025. So we are new. We have no funding, but we're growing. The funding is coming, because I can see it, and there's a lot of connections that are being made. But for right now, we are definitely in need of financial support in the way of, and this is what I'm sharing with corporations or churches. Sponsor an event. All of our events are workshops and webinars. Here locally, we're hosting a site, being a site host. and allowing us to come in and teach fall prevention at your site, online. If this is something that really resonates with you, and Lance, you got to just piece this together because I don't know how to do it. Look, if this resonates with you, reach out.
Yeah.
Here at the Finding a Foothold and the Finding a Foothold Foundation, there is space to give you assistance.
Yeah.
Through workshops, webinars, things locally, things virtually, like in the Baton Rouge area, hosting sites where we can provide workshops at your location. And if you just want to just help out because you know how you've been impacted by a fall because of someone in your life, and you want to sponsor someone to come to a workshop, you can do that. If you want to host the entire workshop, you can do that as well. So look, we welcome anyone who has a heart to want to see our older communities, the people who make us who we are, who invested so much in why we are still here and have the liberties that we have. If you don't want to make life easier for them, just visit the website and see how you can just get involved. And if nothing else, share the news.
Yes.
Share about the foundation, and share the news, share about Finding a Foothold and the Finding a Foothold Foundation. So we can bring these services to you virtually, and all proceeds in the foundation stay in the foundation, and being able to continue to do the workshops and offer it in communities where there is no funding,
right,
where there is no help in getting the word out about fall prevention.
And what website would you like them to go to, Consuela? And we'll put it up on the screen also and in the show notes.
Yes. Findingafoothold.com is the website. And on that website, you will see information about the foundation, the work that we're doing, and other opportunities that we can work together.
Fantastic. Well, Consuela Marshall, author, occupational therapist, founder of Finding a Foothold and the Finding a Foothold Foundation. Thank you, my friend. It's always a pleasure to see you, and you're such a pleasure to know, and just to see the incredible work that you're doing in the community.
Thank you so much. Glad to be here.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Consuela Marshall for joining us today. We look forward to seeing you again here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.